Every day, we go about our routines thinking that, if something serious was happening inside our body, we would surely know it. We expect a major disease to announce itself loudly, with clear pain or dramatic signs. But the truth is often much more subtle and more dangerous. Heart failure, one of the leading causes of death worldwide, rarely begins with dramatic chest pain in the movies. Instead, it quietly shows up through small signals, hidden symptoms that we ignore because they feel ordinary, temporary, or just part of getting older. The danger lies not in the symptom itself, but in how long it goes unnoticed. And that is why learning to recognize these early warnings can quite literally save your life. Today, we are going to talk about 13 hidden signs of heart failure that most people ignore every single day. Some of them may surprise you, because they don't even sound like they have anything to do with the heart, yet they are deeply connected. As we move through each one, think about whether you or someone you love may have brushed these symptoms off, and realize why paying attention could be the difference between a manageable condition and a life-threatening emergency. One of the earliest and most overlooked signs is shortness of breath. You might notice it when climbing stairs or even while lying flat in bed at night. At first, you may tell yourself that you are just out of shape or tired, but what's happening is that the heart is struggling to pump blood effectively, and fluid begins to build up in the lungs. That extra fluid makes it harder to breathe normally. When you need to prop yourself up on pillows to sleep or wake up gasping for air, it's not just stress or exhaustion. It's your body pleading for you to notice that your heart is under strain. Another hidden sign is swelling in the feet, ankles, or legs. People often think swollen feet are just the result of standing too long during the day, or maybe eating a little too much salty food. But persistent swelling is a sign of fluid retention caused by the heart's inability to circulate blood properly. That fluid settles in the lower parts of the body due to gravity, and it's one of the classic, but often dismissed early warnings of heart failure. Many people simply blame it on age, weight, or lifestyle, never realizing that their heart is struggling. Fatigue is something we all complain about, but there is a difference between being tired after a long day and feeling drained every morning even before the day begins. Chronic exhaustion is another key sign. The heart's job is to deliver oxygen and nutrients to every part of the body. When it can't keep up, your muscles and brain don't get what they need, leaving you weak and weary. This kind of fatigue doesn't go away with more sleep or a cup of coffee. It lingers, turning even small daily tasks into big challenges. Weight gain is usually associated with overeating, but in heart failure, the type of weight gain is different. If you notice your weight increasing rapidly over just a few days, and you haven't changed your diet, it may not be fat at all. Instead, it could be the result of fluid building up inside your body. A sudden gain of 2 to 3 pounds overnight or 5 pounds within a week is a serious red flag. Doctors call this fluid overload, and it's one of the clearest signs that the heart is no longer able to manage circulation properly. Sometimes the warning shows up as a cough that just won't go away. It may sound like a dry cough, or it may bring up pink, frothy mucus in more advanced cases. This is because fluid backs up into the lungs, irritating them and triggering constant coughing. Many people think they simply caught a cold or have allergies, but if the cough persists and is accompanied by breathlessness, it could be the heart asking for help. A loss of appetite or feeling full very quickly is another strange but important clue. When the heart struggles, blood can pool in the liver and digestive tract, causing congestion that interferes with normal digestion. You might notice you can't finish meals the way you used to, or that food doesn't appeal to you. Over time, this can lead to malnutrition, which further weakens the body. It is not just a stomach issue. It is a signal that the heart's failure is affecting multiple systems. Another sign that people brush aside is an irregular or racing heartbeat. You may suddenly feel your heart pounding, fluttering, or skipping beats. While occasional palpitations can be harmless, Persistent irregular rhythms are often the heart's way of compensating for its weakened ability to pump. It tries to beat faster or erratically to maintain blood flow. Ignoring these episodes can be risky because they may progress into more dangerous rhythm disorders. Cognitive issues such as difficulty concentrating or forgetfulness are also connected to heart failure. Many would never link a foggy brain to their heart, but when the heart isn't pumping efficiently, less oxygen reaches the brain. The result is confusion, memory lapses, and trouble focusing. People often blame stress, aging, or lack of sleep, when in reality the brain is starving for oxygen because of heart problems. Of course, chest pain or pressure remains one of the most alarming symptoms, though it does not always appear in the way people expect. It may feel like a tightness, heaviness, or squeezing that comes and goes, especially during activity. Some dismiss it as indigestion or muscle strain, but when combined with other symptoms like breathlessness and fatigue, it could be a critical signal of heart trouble. Another subtle clue is frequent nighttime urination. During the day, fluid builds up in the legs and feet. When you lie down at night, that fluid shifts back into the bloodstream and the kidneys try to get rid of it, leading to repeated trips to the bathroom. While this might seem like just a normal part of aging, it can be a direct result of the heart's weakness. Pay attention also to changes in skin color, such as paleness or a bluish tint in the lips and fingers. These signs appear when blood isn't carrying enough oxygen to the tissues. It's easy to dismiss cold hands or pale skin as weather-related, but when persistent, it points to a deeper problem with circulation. Excessive sweating or cold, clammy skin is another silent warning. The body goes into overdrive, activating stress responses to make up for the heart's poor pumping ability. You may find yourself sweating even while resting, which is the body's desperate attempt to cope with reduced blood flow. At this point, you may be realizing that so many of these symptoms overlap with everyday complaints. That's exactly why they are so dangerous. People ignore them, explaining them away as aging, stress, or lifestyle. But when several of these signs occur together, it paints a clear picture that should never be ignored. The question becomes, when is the right time to see a doctor? The answer is simple: as soon as these signs appear consistently, especially if they are worsening. The earlier heart failure is diagnosed, the more options there are to manage it effectively, through medication, lifestyle changes, and treatments that can extend life and improve its quality. Imagine how different the outcome can be for someone who recognizes the signals in time. A person who notices their swelling ankles and breathlessness and seeks help early may be able to slow down the progression of heart failure dramatically. Compare that to someone who brushes it off until they collapse with advanced heart failure, when the damage is already severe. The difference is awareness, vigilance, and action. Every small symptom is like a whisper from your heart. At first, it's gentle, easy to ignore. But if you continue to dismiss it, those whispers turn into cries for help, until it becomes too late. Paying attention to your body's hidden language is one of the greatest gifts you can give yourself and your loved ones. Don't wait for a dramatic heart attack to realize something is wrong. Heart failure doesn't start with a bang. It begins quietly, with swelling, fatigue, coughs, and breathlessness. These signs are not random, they are connected, and they are urgent. So, the next time you notice your shoes feel tighter, your breath feels shorter, or your energy feels drained beyond reason, don't just shrug it off. Consider the possibility that your heart is asking you to take it seriously. Early diagnosis and care can transform what could be a life-threatening condition into something manageable. Many people live long, full lives with heart failure once it's detected and treated. The tragedy is when it's ignored. Think of those you love, and how much they depend on you. Your health is not just about you, it affects everyone around you. Learning these 13 hidden signs is not about living in fear, it's about empowerment, about knowing your body well enough to act before it's too late. The earlier you listen, the more time you give yourself to live, to love, and to enjoy life without the shadow of sudden crisis. So, remember these signals: shortness of breath, swelling, fatigue, sudden weight gain, persistent cough, loss of appetite, irregular heartbeat, brain fog, chest discomfort, nighttime urination, changes in skin color, excessive sweating, and cold extremities. They may look small when taken alone, but together they can reveal a powerful truth about what's happening inside. Don't ignore them. Pay attention, seek advice, and give your heart the care it deserves. Because every heartbeat matters, and it's worth protecting every single day.